So tell us about some of your first experiences with First Choice.
Well, as you know, I've been the CEO for 13 years. But prior to that, about 22 years ago, I was asked by Judge Richard Traub, who represented the courts of New Mexico, to take a leadership role at First Choice. It was a time when First Choice was growing and there were changes, and there were some concerns about the administrative direction of the organization and some concern about the loss of federal support. And at that time, the courts of New Mexico, in reality, took ownership of First Choice to protect the federal support. And Judge Traub, the magistrate judge, was asked to oversee the activity. He asked that I consider, serving in an interim capacity and helping to restructure and reorganize the organization for the future. So I spent a year, on a part-time basis here at First Choice. After we completed that reorganization, which included further development of the infrastructure necessary to grow and to be successful, and restructuring the governance of the organization, I returned back to my work site, which was Presbyterian Medical Services, and left the program in the hands of a new CEO and a new management team. 8 years later, I was contacted by the then board of directors and asked if I would consider applying for the CEO position, and I did. I was very interested in continuing after I spent my year here in that capacity, but I had an obligation to Presbyterian Medical Services that I couldn't negate.
What was it about First Choice that really you felt like this was a place for you?
Well, First Choice, it's a community-based operation, and it has that feel and sense, of a sense of community and neighborhood, and togetherness in terms of achieving. I enjoy that kind of feel and that kind of initiative and effort, and I was thrilled, to have the opportunity to come back. After my year here in the interim position, I really experienced what this organization was all about and what the community was all about. And it was something that I enjoyed and something I wanted to be a part of. I even go back further with First Choice. My wife, was a dental hygienist with the Department of Health that was co-located with First Choice here in the South Valley. So it's a long history. It was kind of returning home in a sense, and it's been a wonderful experience. Yeah.
So now 13 years as a CEO, can you characterize those early years and then what your vision for the organization was?
Yeah, my early term, 13 years ago, when I entered the program formally once again, it required again some restructuring. And so we spent a number of years looking carefully at our infrastructure and what needed to be strengthened in order to prepare the organization for the future. It was a learning period for me as well, to be there every day. So it took a little bit of time. The organization was small. Our operating budget was less than a third of what it is today. We had probably 4 or 5 clinic operations, and they were small. So it wasn't a large practice. We probably employed at that time less than 100 people. The most recent years have been real interesting. The last 4 or 5 years have been tremendously interesting in terms of growth and development. We've more than doubled our capacity to serve over the past 5 years. We've gone from a small practice to a practice that is comprised of 8 health centers and 1 school-based program. We have over 330 employees, of which 70 are providers of care. We served last year approximately 60,000 individuals and families. We provided them with a medical care home. Those individuals came to care over 250,000 times last year. So we're a big practice. Today we're one of the largest primary care practices in the state of New Mexico. Today we're recognized by the other major providers of care, the Presbyterian and the University and Lovelace and Molina, as a major player with respect to the delivery of primary care services. The other major change we've seen, besides the expansion of our capacity to serve over the past 5-6 years, has been our expansion in our scope of practice. And I think this is real important for people to understand. We began as a primary care center. We began by providing primary medical care. We added primary dental care. But as we've worked in the community, as we've listened to the community, and as our board of directors has directed us, we've expanded scope of practice to meet the changing needs of the community. Currently now we've been integrating behavioral health services and have been doing so for the past 4 or 5 years into our practices.
What does that mean to integrate it into the primary care?
Well, let me tell you a story that'll answer that question. About 6 years ago, our board of directors, and our board of directors is a voluntary, community-based board. It's comprised of users of service, we call them consumers, and non-consumers. These are individuals who have unique expertise and know our communities that we feel can help guide us as well. So we have a board of directors. The board of directors came to me and basically said, there's a growing need for access to behavioral health services, access to services for substance abuse and for depression and for anxiety, domestic violence issues, and there aren't the resources in our community. There's no place to go. We need to start talking about how we can make those services available to this community. As a result, we began to explore models and to see if we could actually integrate behavioral health services within the context of the primary care visit. So when someone comes in for a primary care visit, if they have a behavioral health issue that's identified, it can be dealt with within that context of that visit. No more stigma associated with a behavioral health visit, easy access and care. Now, nationwide, it's an interesting statistic, nationwide, 50 to 70% of people who come to primary care have behavioral health issues, most of which are never addressed. People don't have time, they don't pick up the cues that people have issues, and people go on and live with these problems that impact their general wellness and health. So we felt it very important, and again, meeting the need of the community and being directed by the board to address that need. We've begun this integration. So we've expanded our scope to include behavioral health services. We've also expanded our scope to include a level of specialty care. Now, why do we do that? Same kind of reason. There aren't the specialty resources available for our clients, whether it be at the university hospital or even in the private sector. Very limited access to individuals with limited coverage, insurance coverage or no coverage, to specialty care in this community. And so we have begun to work, we began to work years ago in conjunction with the university and to help our providers to become skilled in certain levels of specialty care and to be able to then interact with the specialists at the university through telecommunication opportunities and sharing and presenting cases and providing the care on site. So, now we're doing rheumatology at our clinics. We're doing diabetes education and care at our clinics. We're involved heavily in substance therapy, Suboxone treatment at our clinics. So we've expanded our scope as well. I think that's important. First Choice is no longer the small primary care access point. It's really a large primary care access point that has expanded its scope to include a level of specialty care as well. Again, to meet the needs of this changing community that we serve.
So it sounds like there's a running theme here. The need for even primary care was identified by the community, and there's a continuation of that community input and voice, and then a responsiveness on the part of the providers and the leadership. So it sounds like there's been huge advances over 40 years. What do you think that means to this community, and why as a leader of this organization, do you feel driven to do this?
Again, we're a community-based organization. We're governed by community-based individuals, most of whom are users of our services. I think being responsive to the needs of community is what we're all about as an organization. And so that has been our theme. That will continue to be our theme. And the community actually identifies very clearly, what the issues are. Now, we know that healthcare is only one issue that our communities face. They face other issues, whether it be employment, housing, education. It's our goal as an organization to partner up with other players, to provide more comprehensive coverage of total community need. And we do this, and we continue to work to do this better, each year. But we partner with a number of organizations to do that. We also have become at First Choice, and I think it's worth mentioning, a training center. For example, we rotate 12 family practice residents through our South Valley Health Center every year. We rotate every dental resident from the University of New Mexico. Now, they don't have a dental program, but they have a dental residency program. We rotate each dentist from that program each year through First Choice as well.
What does that do for the resident who's then going to maybe practice here or elsewhere?
Well, let me tell you what it does for the resident. I'll tell you what it does for this community. For the resident, it gives them an opportunity to see a different kind of practice, a different kind of care, really serving community. And they don't have that experience in the medical school training, or in their residency training. So it really gives them a chance to see something very different, something they can get involved in, something they can feel really good about in terms of service to community. What it gives the community is a steady flow of providers. Now that's real important in our situation. You have to remember that First Choice, while we are located in 3 different counties, most of our activities in Bernalillo County. We have to compete with the major healthcare systems for providers. We're competing with Press and the University Hospital and Lovelace, for the same providers. Very difficult, to compete. But if we can get people in through residency and expose them to the kinds of programs we offer, and get them to really understand this type of service delivery and what it really means, and the advantages to them as well. They can have a separate life, besides the practice of medicine in this type of setting. And they enjoy that. It gives us an opportunity to keep a steady flow of providers coming in so we can expand capacity to serve. And we've been very successful. We've been very successful recruiting residents, both medical and dental. Now, we also have medical students, nursing students, medical assistants. We rotate a number of different people in levels of training through the centers that we have. Again, exposure to what we're all about, job opportunity. That also relates to, I think, another function that this organization plays and has played for over 40 years, and that's an employment function. The majority of people who work for us, the majority of the 330 people who work for this organization live in the communities we serve. And a good portion of those individuals and families receive care at First Choice. So we really are providing some employment opportunity and some career opportunity for people in the area. And we're excited about that. And the board of directors sees that as one of our missions, is one of our important missions as an organization. Yeah.
So tell us about some of the recent accomplishments and what's on the near horizon.
Well, certainly one of the recent accomplishments over the past several years has been our ability to acquire resources to build new state-of-the-art facilities. We have been very successful in partnering up with other stakeholders, other people who have an interest in the wellness of these communities, to identify dollars to build state-of-the-art facilities. And why do I say state-of-the-art facilities? Because that's important. You know, in the past, when you thought of community health centers, what was the image? The image was a clinic in an old church, you know, or an abandoned shopping center, you know. As a result, there was a stigma created with regard to community health centers. And that stigma was they're centers for the poor. They're centers for, they're free clinics. They're not. You know, they're centers of excellence for the community. And one way to demonstrate that is to have state-of-the-art facilities and state-of-the-art equipment. And so over the past several years, it's been a major initiative to build these new facilities and remodel the existing facilities and give the community what they deserve in terms of an actual physical plant. So that's been an exciting development. Specifically, we've built a 44,000 square foot Health Commons facility in the South Valley. It's probably the largest primary care practice site in the state of New Mexico. We have medical, dental, behavioral health services there, as well as WIC services, and we share some space in the facility with the Department of Health as well. Last year, we were able to negotiate with our partners, the County of Bernalillo and the State of New Mexico, and we acquired a state building that was in disrepair, had been abandoned over a year ago, and we were able to have that building move from the state to the county, and then the county to First Choice under a lease arrangement. We went to the federal government, we received some dollars for remodeling. We spent about $3 million and we remodeled the facility. It allowed us to more than double our capacity to serve, and this is in the South Broadway area on William Street. A beautiful new facility. Currently, we're in the process of completing construction on a 22,000 square foot medical, dental, behavioral health complex in Los Lunas. The $8.1 million was a federal grant that we received. The new facility will allow us to more than double our medical and triple our dental capacity in Valencia County, a county in real need of access points. That'll be completed in August, and we plan to open our doors in early September. So we've seen a lot of new development in that arena over the past 4 or 5 years. New facilities, expanded capacity to serve, along with what I mentioned earlier, and that is the expansion of the scope of practice. You know, another exciting thing that we've initiated recently is a major wellness effort. We have a wellness director, Dr. Brian Shelley, who's done some very unique things in terms of wellness with staff and provider staff, and now is planning a number of activities with community members. We've just remodeled a wellness room here in the South Valley. Our plans are to have a 20,000 square foot wellness center in the future. So we're very vested in moving forward with wellness kinds of activities for the communities we serve. So that's been exciting.
Is that also tied to community need and like a prevention emphasis?
Yeah, you know, today the language you hear constantly at a federal level, now at a state level, is patient-centered medical care home. First Choice has been involved in developing a medical care home for our clients for over 12 years, you know, and wellness is a component part of that. You know, our struggle has been how do you put all the pieces together for a patient-centered medical care home? How do you have the primary medical care services, dental service, behavioral health services? How do you add the care management piece to that? How do you add the community outreach piece to that when there are limited sustainable resources to support those pieces? You know, so it's been a struggle for us as an organization, but we've moved forward as best we can to develop those component parts. Now we're seeing a lot of interest at a federal level and a state level for organizations to create these, quote, patient-centered medical care homes, which have all these component parts we've been talking about for 12 years. So we're excited about that, and we're hopeful that we're going to see more resources come available to us so we can quickly move in the direction that we've been going for 12 years. You know, so it's an exciting time. It really is. And wellness and prevention is a key component part of the medical care home that we want to provide.
When you think about the future and the legacy that you hope First Choice has really put an imprint on in this community, what What do you hope First Choice is known for into the future?
Yeah. I hope, and I think we are known for this now, but I certainly hope that part of our legacy is that we showed people how they could work together and maximize their collective resource to impact the wellness of community. Okay? One person can't do it alone. And it's not just healthcare that's going to increase the wellness of these communities. It's all the other component parts. It's the jobs, it's the education, it's all these other pieces, the employment that has to be in place. And I think we've shown a leadership, I think we've shown a leadership role to the community, that if we work together, if we bring our resource together and use this collective resource to impact communities in need, we can be successful. And if we do that, there's enough resource. There's enough resource in the system to do that. I think that's our legacy as an organization. Well, you know, a couple years back, you know, we started talking about the need to create a foundation for First Choice. And the thought was that a foundation could do a number of things. One, they could serve as ambassadors in our communities and in the communities we don't serve, you know, to share with them what First Choice is all about and the impact that they're making in the communities in which they reside. The second thing we thought could happen through the foundation is they could begin to help identify ways to generate dollars, to raise money through various donations that could then be used to help support the cost of the delivery of primary health care services to the uninsured and underinsured that we serve. The foundation has been in existence for a few years. We haven't been real successful yet in terms of generating interest or revenue, but we have some ideas. You know, one of our ideas is this. You know, we believe that there's a tremendous need for additional access to health care. And one of the ways to support the expansion of services and to cover the cost of meeting that additional need is to generate revenue outside of our primary practice, which is the delivery of health care. And so we've been talking as a foundation about, are there other businesses, are there other ways, related, but other ways to generate revenue for the organization? And one of the ideas we've come up with is to acquire land here in the South Valley as a part of the South Valley Health Campus, land that we could build on, maybe create 30, 40,000 square feet of office space that we would then rent to related kinds of practices and other businesses, a Starbucks, you know, an eye clinic, you know, different things, adult and child daycare kind of situation, and rent, and again, putting services in place in the community, but also generating some revenue through the rent situation that could then be applied after covering costs, to the delivery of healthcare services for people. So the foundation is kind of taking a little different approach. It's not the approach that many foundations take, and that is, let's go out and raise money. It's, let's figure out ways that we can help the community grow and develop and generate some money that we can then move towards our primary goal of service delivery. So that's kind of exciting, you know, and that's a difficult one. But we have a good group of people. Senator Lopez is the chair of our foundation, and we have some really wonderful people who are helping. So that's a direction we're moving in.
What's the first step in that? How much are you trying to raise?
You know, what we're trying to do initially is raise about $600,000, which would allow us to purchase about a 3-acre site that we've identified here in the South Valley. After that, we would kick off a major capital campaign. Once we had the actual land, we could begin with architectural renderings, and we could really begin to promote what we want to accomplish there. And then we would start a major capital campaign, and we would try to raise about $10 million to cover the cost of all the building. So once we developed the space, there would be no debt service at all. We'd be able to discount rent, so we could get the right people in place for this community, create more jobs for the community. and then begin to generate that rent income that we would apply then towards the cost of providing health care to the uninsured and underinsured of our community.
I've got a couple of questions.
Go ahead.
Where did the idea in New Mexico for the community-based primary care clinic, was that something that came out of rural service areas, or where did it come from?
Well, you know, the Community Health Center program is a major national initiative. And yes, you know, it began as a means to address the needs of more rural frontier areas where there was limited access to health care. That's changed. That's changed dramatically, because I think what has happened now with over, 1,200 nationwide community health centers, systems, you know, what's changed is, I think, an understanding at a federal level that we have the infrastructure already in place to provide services to the 44 million people who don't have health care coverage in an affordable way. You know, we can provide those individuals with a medical care home, you know. And so I think that it's changed. While it was initially the health centers were there to provide care to people who were in frontier or areas in which there weren't services, we're now seeing that it's being viewed as a major player in the provision of services to all the uninsured that exist. So it's changed a bit, and I think it's changed in a positive way. I think one of the things that we've accomplished here for First Choice, but also for all the community health centers in New Mexico, and there are, I believe, about 8 community health center systems in New Mexico besides First Choice, is that I think we have helped people to understand that community health centers are indeed community health centers. They are not centers strictly for the poor. They are not centers, free centers of care. They're centers for everyone in the community. You know, those who can't afford care, you know, are offered the opportunity through a sliding fee scale arrangement. And we use what small amounts of federal money and state money we get to subsidize the cost of care for those visits. Then we make every effort in the world to help those individuals then get on some coverage program, you know, which then gives them a form of insurance. And it frees up those federal and state dollars that we receive to serve more and more people who don't have coverage. But I think you're seeing the community health center systems in this country being viewed very differently now. Being viewed as a major primary care resource that can help this country resolve this issue, you know, and it's a shameful issue of 44 million people who have no coverage.
You've answered my next question, I guess, in a variety of ways. But how would you like to see that idea evolve?
You know, I'd like to see, and to a certain extent, it was evolving, and it's been sidetracked a bit in Congress, but it was evolving. I would like to see the federal government expend those necessary resources to allow community health center systems like First Choice that have demonstrated an ability to use resources wisely and expand capacity. I'd like to see the federal government provide more and more expansion dollars to organizations like First Choice so they can increase their capacity significantly to serve. You know, I think we've proved and continue to prove each year that we can deliver high levels of care, and we can do it at costs that are less than average costs. So that's what I would like to see. I would like to see the community health system evolve to the point where they do become, in fact, the major primary care entry point for individuals throughout the country.
And you've thought of other ways that healthcare can be paid for that help cover that spectrum of the kinds of services First Choice and others would like to provide, a global payment system? Yeah,
you know, unfortunately now the system that exists is based on encounters. Revenue that you receive is based on the encounter you deliver. And depending on the revenue source, the revenue changes. But it's encounter driven. The problem with that is that these ancillary services that we all know are as important as the primary service being delivered. I'm talking about the care management, the community outreach kinds of stuff, the behavioral health kind of stuff. Those services aren't covered through the encounter visit. And so how do you provide those services? How do you sustain those services? You know, one way is to have a capitated rate that's provided for the individual. So you're managing these individuals and you're receiving X number of dollars for their care. You can then use that capitated rate of payment to cover the cost of the behaviorist, to cover the cost of the community outreach person, to cover the cost of the care manager. You know, one of our board members, Pam Galbraith, you know, she's a nurse and worked at the university for many years. In fact, worked in state government as well. She once said at one of our first choice board meetings something that I've never forgotten. And she said this. She said, you know, when people are born, they should be assigned a care manager. You know, and we talked about that because it was kind of funny when she said it. And in reality, when you think about it, our parents were probably our care managers to a large extent. But our world has changed so much and our environment has changed, the parents don't have the kind of time to really do that anymore. You know, people need care management. You know, they need that direction. And so, and that service to a large extent isn't covered through the encounter system. You know, there's got to be a way to support that cost. Now, at First Choice, in this interim period, we have found ways to manage some of that cost. But we need to expand the kind of service that we provide, and it requires a flow of revenue to support that cost, and that's the issue. With the capitated system, I think you resolve that problem. And I think what you would show with the capitated system in place, that you're providing these comprehensive and these ancillary services, I think what you could show over time is you could show improved health outcomes and lower costs, you know, which is the healthcare debate, you know. And so we have been talking for a number of years with partners about how do we structure, you know, this model and test it and prove to the funding agents. Now, HRSA, the Health Resources Service Administration, recently issued a series of requests for proposals under a unique program of demonstrations where they were willing to fund demonstrations to test different models. We've partnered up with Dr. Art Kaufman and another community health center and others, and have applied for funds that would have let us do just that, test our model, put all our pieces in place, you know, and demonstrate how the impact of having that comprehensive set of ancillary and primary services impacts health outcomes over time and costs. And I think once we can demonstrate that, I think it's no longer an issue. I think that the way that we will be reimbursed will change, and it'll be capitated versus encounter-driven. When I came aboard 22 years ago as a court-appointed director, First Choice was struggling with a number of issues, like any organization struggles that's growing and changing and trying to meet needs. Again, community-driven program. Trying to be responsive to the needs of the community, but at the same time being restricted by revenue streams and ability to support those activities. As a result, the administration was trying a number of different avenues to be successful, and staff and others became concerned that the approaches weren't the correct approaches. As a result, there was a lot of tension among the administration, the staff. Certainly the board was involved, and it created an environment that many believed, Senator Domenici being one, believed that could compromise the federal support of the program. So that's when I was asked to come in. And when I examined everything, I certainly found nothing that was wrong, you know, there was no impropriety at all. Many of the programs weren't well thought out. And so what we had to do is just restructure, you know, and restructure around our primary goal of service delivery. and then try to better understand how we could grow from that base. Now, it also required putting in new systems for the financial piece. It required new systems for data collection, and so we could report appropriately to the federal government, state government, others that we partnered with. So we did that. We set up that infrastructure that was there, but it needed shoring up. And then we moved on.
Were some of the issues at that time related to changes in the bigger picture of the role of insurance companies, the bigger picture in terms of medical provider?
You know, I don't. You know, at that time, I don't think so. I think mostly what was occurring at that time was a lack of leadership in the sense of where do we take this organization? How do we get there? The board certainly had a clear vision where they wanted to go. It was how do you get there? It was the nuts and bolts of getting there. Certainly changes were occurring constantly in terms of financing these centers and how revenue was being generated and what opportunities were. You know, back then, less than 1% of the clients who came to First Choice had insurance. So there was virtually no revenue from the private sector insurance. Today we have 12%. So things changed. Payer mixes weren't in place the way we have them in place now. You know, and when I talk about payer mixes, I'm talking about, you know, Medicaid and the Salud program in the state of New Mexico. I'm talking about Medicare. I'm talking about here in Bernalillo County, UCare, Partnership in Health, the indigent dollars in other counties that are available. A lot of those payer sources were not yet functional, you know. So this organization was struggling. They knew they had a tremendous need to expand and provide more access. There wasn't a lot of revenue streams that they could identify to help them grow. So it was a time of a bit of turmoil, you know, and lack of clear direction. But certainly there was no impropriety or anything. The organization was always very focused on a mission of service.